Hello everyone, let's talk about popliteal cyst today. So the name itself suggests popliteal, that means it is in the popliteal fossa, also known as the Baker cyst. This is also known as Baker cyst because it is a collection of fluid filled swelling. It is a fluid filled swelling behind the knee, is caused by the underlying knee joint disease like arthritis or meniscal tear. So located behind the popliteal fossa, connected to the knee joint through a channel. So the most common causes of the popliteal fossa is like rheumatoid arthritis, osteoarthritis, and sometimes caused by trauma like meniscal tear. So all these things causes either the increased fluid production or decreased drainage, leading to the fluid accumulation. So what happens if the fluid moves from joint space to the gastrocnemius and semimembranosus muscle behind the joint. So we talked about etiology. So mostly the symptoms is it is mostly asymptomatic. So there will be a symptomatic bulge. Okay, so there will be a symptomatic bulge causing discomfort or pain behind the knee, and which is specifically produced when flexing or extending the knee. But mostly it is a asymptomatic bulge. But there will be some complications of the Baker cyst, like sometimes it may rupture, which is eventually causes the pain, erythema, or swelling. And of course there will be a difficult joint mobility. Sometimes there will be calf dissection, that is the fluid extends from the joint space behind the knee and it reaches down to the calf muscles, causing separation of some parts of muscles. So there will be something called crescent sign, that is sometimes there will be ecchymosis. So ecchymosis in the foot region, mostly distal to malleolus. It can be present either in the middle region or the lateral region, and sometimes it may make DVT like, because there will be venous compression due to the cyst. Okay, so there will be venous compression due to the cyst, so it might mimic DVT, and we can differentiate between DVT and popliteal cyst simply by doing USG. Okay, so simply the diagnosis is made by physical examination and confirmed by ultrasound, and sometimes MRI may be needed whenever there is suspected complication or there is complication. And the treatment is usually conservative because mostly it is asymptomatic, and we can do rest, ice compression, elevation, and anesthesia of pain. Sometimes we might need drainage or surgery depending on the complication. And so this photo is from osmosis. So it shows that how to demonstrate the positive Hohmann sign. So there is something called Hohmann sign. So what you have to do is that you have to flex the knee a little bit, and you have to abruptly flex the ankle, dorsiflex the ankle. Okay, so not frontal flexion, you have to dorsiflex the ankle. So this will cause pain in the joint space region and sometimes in the calf region. Okay, so this is called Hohmann sign, which suggests the presence of the popliteal cyst. Okay, so we have got two very wonderful photographs. The first one is MRI knee. Okay, so you can see the joint space here. Okay, so this is I think this is the patella, and we have you can see there is a fluid collection behind the joint space, and there is muscles. Okay, so this is popliteal cyst, so it can be easily identified by the MRI, and there is, you can see the reddish discoloration in the foot region, just be distal to the lateral malleolus. So these are ecchymosis, also called as crescent sign, which is a complication of Baker's cyst. Okay, so that's it for now. Let's summarize it once. Popliteal cyst, also known as the Baker's cyst, presence of the fluid swelling in the joint space behind the knee, located in the popliteal fossa, causes is like rheumatoid arthritis, osteoarthritis, meniscal tear. Okay, so the fluid usually moves from joint space to the gastrocnemius and semimembranous, and so there will be symptoms like asymptomatic balls, discomfort, and there is one peculiar feature like the balls decreases. The size of the balls decreases on flexion of knee. Okay, so on flexion of knee, the size of the balls decreases. And complication like rupture, calf resection, crescentic sign, and DVD-like features due to venous compression will be there. And diagnosis can be done by physical examination, ultrasound, or MRI. And there is just two specific signs like Homan sign and crescentic sign, which can be demonstrated. Thank you.